everyone. This is Dr. Kiggundu Spire. I work with Henry Hospital as a Gynae-Laparoscopic surgeon. Today we are going to talk about instruments or instrument design. We shall talk about all the laparoscopic instruments that will help you during your practice. We shall begin with the instruments used during entry and insufflation, and we end up with the instruments that are used to close the ports or port closure. So we shall try to endeavor to go through all the basics of instrument design, the purpose, maintenance, troubleshooting, and the relevance to the laparoscopic surgeon. So we shall start with the Veress Needle. A Veress Needle is one of the most important tools on entry. We use a Veress Needle to enter the abdomen and initiate pneumoperitoneum. The Veress Needle was discovered by a Hungarian surgeon or physician, and it was discovered for the purpose of draining pneumothorax because it has a protective mechanism of a spring and a blunt part of the eye. So this helped them to drain pneumothorax without injuring the lung tissue. So eventually it was adopted to help with access to the abdominal cavity. The Veress has two parts. It has a styrate and a shaft. This is a styrate, and then this is, you can call it a barrel. The styrate has the spring, and the spring will help to retract when you enter the abdominal canal or the abdominal cavity, leaving this blunt part of the Veress. On the other hand, the barrel has a sharp end, which will help to go through the tissues of anterior abdominal wall. So this stylate also has the valve, which helps you to open and close to allow in carbon dioxide or to stop carbon dioxide. The Veress come in different sizes. Basically, the stylate has different diameters. You have a 1.8 millimeters and then a 2 millimeters. It will also come in different length. There is one of 18 centimeters, and then there is a longer one of 20 centimeters. You have 18 centimeters, and then a longer one of 20 centimeters. Basically to help you to access large abdomen. So if you have an obese patient or in a bariatric surgery where the abdominal wall is quite large, then you would most likely use the 20 centimeter. In the average size adult, you'll need the the 18 centimeter Veress. Now, the other thing to note is that the Veress has an eye at the styrate, and the eye will only allow in 2.5 liters per minute of gas, of carbon dioxide into the abdomen. So even if you increase to 5 or 10 as your flow rate, the Veress will only allow you 2.5 liters per minute. And this is the reason why when you're using Veress insufflation for primary pneumoperitoneum, we state the initial reading of the flow rate to 1 to allow in gas at a slow rate, and this will help you in case you're in a wrong cavity, for example, in a vessel, to avoid the risk of having gas embolism. So this is basically a Veress for you. The other function of the Veress Needle, apart from achieving pneumoperitoneum, you can improvise the Veress for closing the port. The Veress can also help with port closure. We shall demonstrate that during our session of port closure. The only way to hold the Veress Needle is like a dart. So during entry, you hold the Veress like a dart. You test its spring mechanism before using before accessing the abdomen, first test the Veress for its spring mechanism, test the valve, then you hold it like a dart. Then you enter the abdominal wall at an angle, usually 45, towards the sacrum, and that is the safe way of entry. You feel the first click and the second click, and basically that will help you to know that you're within the abdominal cavity. Once you're in the abdominal cavity, then you test the Veress for safe entry by doing a suction irrigation test. You get a syringe with a bit of saline, and first of all you irrigate and then suction. Suctioning out, you should see bubbles, and then you do what you call the hanging drop test, where you put a bubble on the tip of the Veress and lift the abdominal wall. If the bubble is sucked in, that means you are in the correct position. Of course, that is not 100%. You have safety, you have to confirm using the quadrimanometric indicators of the insufflator. So that is Veress for you. We've seen the uses of the Veress, we've seen the design, the different sizes of the Veress, and you should always advocate for Veress safe entry. I know during entry some people use direct trocar entry, others they use V-spot entry with the aid of a telescope, but it is always safer to use a Veress needle. Thank you very much for watching.